Okay, hi, it's Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And right out of the gate, you can see this blue cannula coming in the front of the shoulder, just to the left of your biceps tendon. As we look down at your biceps anchor, this looks like one of the problems here. Actually, let me give this back to you. Hand me that crochet hook right there, please. The other. So your biceps anchor looks like it's torn, and that's a reason why you wouldn't get better despite our rotator cuff injection. So this is what we call a SLAP lesion. And this is enough of an injury that you haven't gotten back to doing everything we want you to be able to do. So we're going to take a spinal needle and we're going to pass it right through the biceps now. So try and get a good look at it. So there's our first pass through. We're going to go ahead and hold the camera now. So your main thing now is going to be for the camera. So 2 hands on it, 1 hand here, so you can adjust the picture. Yeah. Just try and keep me in the middle of the screen. Okay, so we're going to pass a black wire through that needle. I'll put you back just a little bit. Okay, great. I need a grasper. Yeah. So in just a second, you'll see the wire. There it is. That's called a super shuttle. And now we're going to reach in with our grasper and retrieve it. We'll back the needle out. And now we're going to take a suture, so levels about like that. And we're going to load that relay with this suture here. If you keep watching on the screen, you'll see that as we pull back. There it is there. And so now we're going to do the same thing one more time. We'll take the spinal needle again. And we'll see about passing through. So that looks like a good spot. I just want to make sure we're getting through. Yep, we're getting through a good part of the tendon there. So now we're going to feed that wire once again. We'll show you some more in a minute. Okay, so here you can see we're retrieving the relay. We're doing something a little bit different here. On the second pass, we're getting the relay from around the backside. You can see here from around the backside of the tendon. And now when we load this, that's going to give us a slightly different kind of stitch. We call it a purse string stitch. It's a stitch that tightens on the tendon the more you pull on it. So it's a real secure way to grab this tendon. And now as we pull tight, you'll see that stitch tighten up on the biceps. So there we go. So now we have a good stitch around the biceps. Now we'll take a pair of arthroscopic scissors and cut the biceps at its anchor. So we're going to be right about here. I'm going to pull tight on the sutures, and we're going to release the biceps way down here. Okay, and so now we're going to take our shaver and just clean up the rest of the joint. So far, the good news is your rotator cuff on this side looks good. So we'll put our shaver in. So far, this undersurface of the rotator cuff looks pretty good. Now, we're going to have a look from the other side, but right now, I certainly would not take down that tendon to do anything to it. That looks good. So it could very well be that just your biceps anchor was the ultimate source of what was bothering you once we got the cuff under control. So I'm going to use this just to smooth out a little bit of the labrum here. Now that the biceps is removed, this shouldn't be a problem. I'll show you some more in a little bit. Okay, now the other thing we can see here is that you've got a fair amount of arthritis in the joint. You can see there's an area here at the bottom of the glenoid, the inferior aspect of the glenoid, where you've lost a lot of cartilage and you've got some kind of degenerative labral tearing. Okay, and so this is the type of appearance and diagnosis for which we do a lot of our orthobiologic injections, whether it's platelet-rich plasma or the bone marrow concentrate, which of course you've had. But again, I think the actual mechanical problem of that biceps anchor, that SLAP lesion, was the ultimate culprit here. But either way, we're still smoothing this out, making sure there's nothing clearly loose. Okay, so we're in the subacromial space. We've already taken off a little bit of bone from the undersurface of the acromion and even a little bit from the clavicle. And we've actually already done the biceps tenodesis, which I'm going to show you in a minute here. But the main reason I came back up on the video was to show you the rotator cuff and how we assess it from this bursal side. So this is the posterior aspect of the cuff back here. You can see the muscle coming into it. That would be more on the infraspinatus side. And then this is the main portion of the supraspinatus coming down here. And the most important thing is we're not seeing any defect in the tendon. So I think the injection we did the trick. And as we remove some of this bursal tissue, we can get a real good look at the rotator cuff. As I rotate your arm, that's the rotator cuff moving there. Okay, so all the way from the back to the front, that looks good. Your biceps tenodesis is sitting right up here. It's down in the bone right about there. And so that looks good as well. We used an anchor that we call a pop lock anchor to secure it. And I think now we're just going to go ahead and close up the portals and get you back to the recovery room in just a few minutes. So that should be the end of the video as well. Okay, so good luck to you now. Bye-bye.